The University of Maine Alumni Association Bernard Lown Humanitarian Award is sponsored by the University of Maine Foundation.
I'm Dr. Bruce Levitt. Dr. Paul Plourde may be best described as a clinical investigator.
With your help, we can improve the quality of life for American women and their families. Thank you.
Colleagues call Dr. Plourde's contributions to novel hormonal treatments of breast cancer unparalleled.
For those who have advanced breast cancer, incurable, you'd like to develop therapies to make them live longer and better. For those patients with curative cancer, you'd like to develop therapies to decrease the likelihood of it ever coming back. And ultimately, you'd like to develop therapies for preventing cancer from occurring in the first place. Paul's triumphs were in all three potential goals for the development of an anti-cancer drug for breast cancer.
He was instrumental in developing anastrozole.
When we have new possibilities in both medicine and medical devices, and what we want to do is get those to people as quickly as possible.
Just as the Clinton administration sought to accelerate FDA approval of safe and efficacious drugs.
Well, Dr. Plourde knew about that. And so when he heard that, he submitted the application for approval of anastrozole right away. Most drugs take at least 2 or 3 years, and the drug was approved in 43 days. Anastrozole really became the treatment for hormone-dependent breast cancer.
The Federal Food and Drug Administration recently approved a new drug to treat breast cancer.
The new drug is considered a breakthrough for women who have advanced breast cancer.
That offers quality of life to these women, which in previous years they did not have with these drugs. So this is an advance for women with advanced breast cancer.
Dr. Plourde also helped bring a life-saving drug to American children.
You know, childhood leukemias was a death sentence for young children for a long time, until chemotherapy came around that literally converted a death sentence to a cure.
Many children developed an allergy to treatment, but Erwinazi, developed in Europe from a different microorganism, could safely treat children with the allergy. Plourde joined EUSA Pharmacy to bring Erwinazi to the United States.
And one of the most attractive things about Paul in that interview was how much he cared about the idea that this was a very important medicine that would really help children in the US.
EUSA launched a program to deliver the treatment to patients on a compassionate basis.
Over the course of about 4 years, we treated just short of 1,400 patients. That's quite a lot of people to benefit, isn't it? That's kind of like one a day. And there aren't many doctors who can say that they've given a potentially life-saving cure to one patient a day for every day of 4 years.
Ordinarily, someone that works for a pharmaceutical company, it's a very much top-down organization, and there's not a lot of individual innovation where an individual with vision can put forward their idea in a large organization and have that come out and be accomplished. Paul did that.
He has a broad compassion for patients, and it's underpinned by a very scientific brain, actually.
His scope of impact has been really rather dramatic. From breast cancer and different forms of breast cancer to childhood cancers, it's been really quite dramatic.
Over the last 20 years, progressive stages of treatment have occurred to the point that women with very early disease are being treated. And that's very exciting because a significant number of women now will be cured of their disease with surgery and with tamoxifen.
Dr. Plourde, you don't know me, but I know you. My name is Jenny Lloyd, and I'm a breast cancer survivor. My job, my joy, is to guide women and men to the support and care they need at Northern Light Cancer Care. On behalf of the hundreds and thousands of patients living better lives, thank you.
Dr. Paul Plourde, a saver of hundreds of thousands of lives and recipient of our Bernard Lown Humanitarian Award.
Being in the medical profession, Dr. Lown's contribution is well known to many of us. Truly a great honor to receive this award bearing his name. I was recently asked what the most important thing the University of Maine did for me. Certainly they provided me with a great education and a nurturing environment. But the best was meeting my wife, Nancy, while at the university. When I told my wife about being selected for this award, I could see her first thoughts. Boy, is he going to be harder to put up with now. I'm fortunate and glad that she did put up with me all these years and allowing me to pursue my passion. She was a great student at the University of Maine and also became a physician. Early in my medical career, I quickly realized the power and the importance of having effective and safe medicines. While a medical student at the University of Vermont, my first clinical rotation was surgery. Very early one morning, I accompanied a general surgeon to see an 80-year-old woman who had significant GI bleeding due to peptic ulcer disease. The surgeon explained to the family that she would certainly die without surgery, but even with surgery, her chance of surviving was very low due to her advanced age. She died 2 days later. Today, with better medicines to control peptic ulcer disease, we rarely see the morbidity and mortality that this woman suffered. The surgical procedure that this 80-year-old received is rarely done today because of the power of good medicines. As I progressed in my medical training, I always wanted and needed better medicines, which were often lacking for the most critically ill patients. In my endocrine practice, I saw the ravages of diabetes, and yet the medications and tools to control blood sugars were either lacking or suboptimal. I needed better medications to offer patients. This was one of the reasons I entered the pharmaceutical industry. I was fortunate to have the opportunity to participate and lead teams developing drugs. The transformation of a small molecule into a drug is a lengthy, complex, and regulated process that cannot be done by one individual. These teams share my accomplishments, including this award that I am honored with today. Each team member was inspired by the thought that our work would help patients, always remembering that a patient could be a family member, a friend, a colleague, and possibly even ourselves. I never realized that my journey in developing breast cancer medications would have a profound effect on my own family. My mother was diagnosed with early stage breast cancer and was given tamoxifen, a drug I helped to develop for early stage disease. After 4 years on tamoxifen, she had a recurrence, which unfortunately gave her a life expectancy of about 2 years. After receiving this news, I met with her oncologist, and he agreed to give her a new hormonal agent that the team and I had just developed and the FDA had just approved. The drug was Arimidex. She gained an additional 3 years of life beyond which was predicted. Arimidex had given her the most precious gift, time. That is the power of good medicines. A little over 10 years ago, my wife was diagnosed with early breast cancer and was also given Arimidex and tamoxifen. She is now a long-term breast cancer survivor. Thank God for good medicines. My accomplishments are really those team's accomplishments, but the most important team member I failed to emphasize previously is the patient. Patients who enrolled in clinical trials and teach us so much. Sure, many enter clinical trials are motivated by hope that they will derive some clinical benefit, but most also participate in clinical trials to benefit future patients with the same disease. These clinical trial volunteers did so as humanitarians, helping to find more treatment options and better medicines for people they did not know, would never know, but yet they felt a strong kinship. It is these patients that are true humanitarians, and for them I'm delighted to accept this great honor. In closing, I want to thank my chemical engineering instructors at the University of Maine who supported my quest to enter medical school. At the time, there was no biomedical engineering program at the school, but they continued to encourage me to pursue my ambitions. Also, thank you to my many brothers at Sigma Phi Epsilon, in particular my roommate Jim Tamro, who made my journey at the university so special. A special thank you to Drs. Santon, Locker, and Korn for nominating me, and thank you to the University of Maine. Go Black Bears.